Hello, my name's Ollie Jay. I'm a Professor of Heat and Health at the University of Sydney in the Faculty of Medicine and Health. And today we're sitting here in the new Susan Wakehill Health Building on main campus in Camperdown, New South Wales. And this is my Study Australia Masterclass. I'm a thermoregulatory physiologist, and I'm particularly interested in the way in which extreme heat impacts human health and well-being across the human lifespan. A lot of the work that we do examines the way in which people physiologically respond to different types of extreme heat, how different low-cost, sustainable cooling interventions can help them navigate their way through these extreme heat events without suffering the ill effects. We know that climate change is real. We know that there's inevitable climate change coming in the near future as a legacy of human activity to date. So it's like trying to turn around a very large ship, is that it's going to take time for us to really reduce future heating. So in the meantime, we need to figure out a way of helping as many people as possible to adapt and manage as best as they can with the extreme heat that's going to be occurring over the next 2 or 3 decades. We know that already extreme heat events, or heat waves as they're called, impact human health quite significantly. In fact, we know that heat waves even now kill more people than all other natural disasters combined globally. What we know is that with climate change and increases in average temperatures in the future, we know that heat waves are going to become more severe, they're going to become more intense, they're going to last longer, and they're going to occur more often. So more people are going to be at risk of these extreme heat events. And the work that we're trying to do is make sure that we work with public policy experts to ensure that the adaptive capacity of humans moving forward is as optimal as possible. So what's really important is that the way in which we reach these individuals is through public health messaging. But what we really want to make sure is that the public health messaging is based on scientific evidence. And we're responsible for gathering that scientific evidence and populating that advice with the most effective information possible. I think we've really got to think about the different types of populations that we're targeting. The most vulnerable during extreme heat events or just sustained hot weather are people who can't afford air conditioning, or maybe people who actually can't afford electricity on a day-to-day basis. Another thing that we really need to consider is the fact that the electricity grids that supply electricity to the wider population, they're often vulnerable to interruptions to power during peak extreme heat events. So some of the work that we're doing is trying to answer the question, what do we do in the case of a blackout? Or what do we advise to somebody who doesn't have any electricity whatsoever, so they can't even plug a fan in, let alone operate an air conditioner? So the type of scenarios that we're looking at are, if you just have water as a resource, how can you best use that water in order to mitigate the physiological heat strain that develops and that can ultimately be actually deadly under these particular conditions? So we've recently published a paper in the Journal of American Medical Association that has simulated this scenario, and we've assessed, okay, what do we do with this water? Do we apply it to the skin surface? Do we insert our feet in the water in a bucket, or do we drink it? So, and what we found is that the prevailing strategy that was most effective was actually applying this water to the skin surface. This kind of makes sense because the only way in which we really keep cool physiologically during extreme heat exposure is through sweating. But importantly, it's not the production of sweat that keeps you cool, it's the evaporation of sweat. So if you do the same job as sweating by applying water to the skin surface, then that water can subsequently evaporate. It's a very effective way of keeping cool and, in a sense, actually maintaining hydration without having to drink extra water. That last point is really important under contexts where water is limited in terms of how clean it is. So we're simulating a condition such as the 2015 heat wave in Karachi, Pakistan, where only 10% of the water available is actually clean enough to drink. Yet one of the number one things that we're telling people to do during extreme heat exposure is to drink more water. But if it's scarce, then what else do we do? So we're trying to work with some various devices that we're developing where we can make the water that's not clean enough to drink, but you can make it clean enough to apply safely to the skin surface. That water subsequently evaporates and it keeps you cool and also prevents thirst developing as well. A lot of the work that we've done recently is looking at the impact of moving air instead of chilling it. The reason that this is important is because chilling air is very expensive and energy intensive. So if you move air with devices like electric fans, this is 50 times cheaper and cleaner than chilling it with air conditioning. So we're trying to better understand the way in which we can use these simple, low-cost and accessible cooling devices to help people keep cool during extreme heat events. Now, one of the questions that people always ask me when I talk about this type of work is, why wouldn't we use a fan in a heat wave? And the main reason is that the World Health Organization tell us not to. So when the air temperature is above 35 degrees Celsius, we're actually told to turn fans off because they think that it will accelerate body heating and increase the risk of negative health outcomes during heat waves. So in our simulated heat waves in our climate chamber here at the University of Sydney, we've actually developed or collected systematic data in human participants to actually measure the way in which electric fans actually keep people cooler, reduce the rate at which they're dehydrating, and reduce the amount of work their heart has to do, which is ultimately one of the most dangerous things that occurs during extreme heat exposure. And we've demonstrated that fans are actually very effective cooling devices up to temperatures as high as 42 degrees Celsius. And this is very important information, particularly for developing countries or situations where people can't afford air conditioning. So we're really trying to narrow the inequality gap between the people who are most vulnerable during heat waves and those who can afford air conditioning. So a lot of the work that we do looks at older adults and trying to better understand how extreme heat affects their health and subsequently what we can do to improve their health outcomes during extreme heat exposure. One thing that we know from the epidemiological literature is that older adults typically are hospitalized or die due to cardiovascular complications. Often they have underlying cardiovascular disease, and then that gets worsened during extreme heat exposure. So the work that we're doing is trying to understand the underlying mechanisms for why we see that in the mortality and morbidity data. And what we've found is that it's not necessarily core body temperature that's getting too high in these individuals. It's actually before that. So one of the main ways in which we try to keep cool initially when we're exposed to extreme heat is we have a process called cutaneous vasodilation. This is simply a redirection of warm blood from deep in the body core, and we redirect it towards the skin surface by opening up the blood vessels in our skin. We've only got so much blood inside the body, and in order to maintain blood pressure, our heart has to beat more times every minute in order to maintain our consciousness and blood pressure. So subsequently, what happens is that the heart has to do more work when you're exposed to the heat to maintain blood pressure. And this is all autonomic. We can't consciously control any of these processes. So if there's an underlying cardiovascular complication, such as coronary artery disease, where we're unable to deliver oxygen via the bloodstream to the muscle cells inside the heart in order to enable it to contract repeatedly and forcefully, then we're at a greater risk of a catastrophic cardiovascular event. So we're trying to design studies to try to better understand those mechanisms and ultimately try to prevent those situations occurring in the future. A lot of the work that we do for older adults is in parallel with the work that we're doing to help the most vulnerable in extreme heat waves, which are often people who are socio-economically disadvantaged. So they can't afford air conditioning, they have very low resources, so their adaptive capacity is consequently shrunk down quite significantly. So that's why it's really important that the work that we do when we're looking at cooling strategies, we're not looking at very expensive high-tech cooling vests, for example, because the most vulnerable, the people that we're most concerned about when we're considering the future impacts of climate change and extreme heat, they're not going to have access to these types of resources. So it's really important that we look at things that are very simple, that everybody has access to, and importantly are sustainable. So we're not advising people to adopt action that actually contributes to making the problem worse further down the track. We have human participants that come into the climate chamber, and we measure their physiological responses. Some of the main things that we look at are core body temperature. So we measure that with a probe that's inserted up the nose and down the throat. It's something called esophageal temperature. This is a very effective way of monitoring body temperature because it gives us a good sense of the temperature of the blood that is being pumped around the body by the heart. We also measure the rate of dehydration, and also we measure cardiovascular responses. So we measure things like heart rate and blood pressure, and from those data we can determine how much work the heart has to do. So we bring participants into the chamber. We test people from across the human lifespan. So young kids as young as 9 years old, and the oldest participant that we've tested is 90 years old. We also test clinical populations as well, such as people with coronary artery disease, or people with different prescription medications in their system, or even pregnant women. And what we do is we assess how well different cooling strategies mitigate the rise in these different markers of physiological heat strain. So with this information, we can actually systematically determine which types of strategies are most effective at actually physiologically keeping people cool during exposure to these extreme heat events. Another really important part of our research program is that we also simulate heat waves of the future. So we work with climatologists who have climate models who can determine how hot and how humid future heat waves are going to be depending on the different carbon emission pathways that we can set ourselves on. So what we can do is then simulate those conditions and actually demonstrate the impact of those future heat waves on potential human health and well-being, particularly in a survival context, so the most vulnerable, such as people who are old or people who have type 2 diabetes or suffering obesity, but also looking at the way in which the ability to complete simple work tasks might be compromised in the future. And we also test our own body heat quite often, so sometimes we'll, as a group, we participate in fun runs or annual run competitions, such as the City to Surf, which starts in the city centre and finishes up down at Bondi Beach. And often what we're concerned about is how hot we're going to get. So what we can do is actually swallow a pill, which is a telemetric pill, which then emits a signal, which we can pick up with a handheld device, and it tells us how hot our body temperature is on the go. So that's one way that we might look at our own body temperature responses as well. My research program right now is looking at the way in which extreme heat and hot weather impacts human health, productivity, and well-being across the entire human lifespan. So starting with pregnant women, we know that from the epidemiological literature is that pregnant women during the latter stages of their pregnancy, when they're exposed to very hot weather, there are a much greater risk of premature deliveries and stillbirth. We don't understand the underlying mechanisms for those data and or those health outcomes in the epidemiological literature. So we are conducting experiments at the moment in our climate chamber where we are asking pregnant women at different stages and different ages to exercise in the heat and try to identify what range of conditions are actually safe for these people to be able to carry on being physically active during pregnancy. This is particularly important because we know the downstream benefits of regular physical activity during pregnancy for both the mother and the child once it's born are very, very important. So we're trying to determine what the environmental limits are for safe exercise during pregnancy in pregnant women. As we move from pregnancy to young children, we currently have funding from the National Health and Medical Research Council to develop the world's first evidence-based extreme heat policy for child and youth sport. So what this involves is us bringing over 500 children of different ages from as young as 8 years old to 17 years old and asking them to run at different exercise intensities at different combinations of temperature and humidity, and we are assessing how hot and dehydrated they become. From this information, we'll be able to determine the environmental limits at which we can recommend safe exercise for child and youth sport throughout an Australian summer. But this information will also be very useful for other countries as well, as once we determine what those conditions actually are. As we move into adulthood, we do a lot of work with extreme heat and elite sport. So I'm responsible for developing the new extreme heat policy for the Australian Open Grand Slam tennis tournament. Associated with this was the development of a novel heat stress scale called the Australian Open Heat Stress Scale. And this has been used 3 years in a row now. And I've developed an algorithm that enables the organisers to determine what the heat stress risk is for the participating players. And we introduce evidence-based interventions to mitigate that risk, such as introducing cooling strategies that we know work based on laboratory data that we've collected. We also introduce breaks in between sets in games. And ultimately, we have also cancelled play on days where the extreme heat stress risk is too severe. In addition to elite sports, we do a lot of work with community sports. So we've developed the community heat policy for Cricket Australia, which is now used across all community cricket tournaments in Australia that are regulated by Cricket Australia. And this covers over 680,000 registered players every year. We've also done work for the National Rugby League. We developed the new extreme heat policy for the 2017 Rugby League World Cup as well. We look at adults in an occupational heat stress setting. So we try to really better understand the way in which hot weather and sustained heat exposure impacts people's health and well-being in an occupational context. So we currently have funding from the Wellcome Trust in the UK to look at the working conditions and developing sustainable, effective cooling strategies for people working in ready-made garment factories in Bangladesh. So right now we have a factory in Bangladesh that is kitted out with over 60 different sensors that are giving us an online assessment of the temperature and humidity of that factory throughout the year. And once we have that information, we then recreate those conditions in the laboratory here in Sydney, and then we simulate different work tasks, and we assess what different types of environmental conditions impair the ability to complete this work, and what we can do to mitigate the heat stress risk so people are comfortable, they are safe, and they're also productive as well, which is really important in the context where people need to optimally perform in order to get paid as well. As we move on to the later stages of adulthood, we're doing work around menopausal hot flashes in menopausal women. So this is a project that we're doing in conjunction with the Shop Distributive and Allied Employees Association in Australia. And what we're trying to do is identify the critical thermal comfort threshold at which women during menopause actually feel uncomfortably warm. And this will enable us to provide evidence to drive air conditioning policy for different factories and workplaces across Australia. We're also doing physiological studies to get a better understanding of the underlying mechanisms responsible for menopausal hot flashes in menopausal women as well. And the reason that we need to do that type of work is to develop effective and impactful interventions that mitigate the negative effects of menopausal hot flashes, particularly in a work-related context. As we move into older adults, we have a very large study that is currently underway, also fortunately funded by the National Health and Medical Research Council. And this is looking at developing or identifying the optimal, sustainable, low-cost cooling strategies that we can advise older adults to use during extreme heat events. So the approach that we're taking in this particular case is that we're actually simulating heat waves of the past. We're looking at the Chicago heat wave of 1995. We're looking at the Adelaide heat wave of 2009 and the Paris heat wave of 2003. We go into the meteorological records. We extract what the peak temperature and humidity was during those extreme heat events. We then simulate those conditions in the climate chamber. We expose our older adult participants to these conditions. Some of them have coronary artery disease as well. They're clinically monitored throughout. They have to go through a stress test to make sure that it's safe for them to do so. And then we systematically assess which sustainable cooling strategies are most effective at mitigating the rise in core body temperature, mitigating the development of cardiovascular strain that can ultimately be deadly in these particular conditions. So we're using this very large project to develop scientific evidence with which we can inform public health policy, not just in Australia, but hopefully across the world. So I'm very fortunate to have an amazing research team that I work with. In my laboratory, we have a total of 11 people working in the lab. We have myself, who's the director of the lab. I have 2 excellent postdoctoral fellows. One has come from the United States, the other has come from the United Kingdom. And I have currently 8 full-time PhD students as well. And many of those PhD students are working on projects that I've described already. They're really the engine behind the work that we're doing. And there's lots of opportunities to work on different projects as students are completing their PhD studies. A lot of the PhD students in my program, they've come from all over the world. We have a PhD student from Singapore, another from the UK, another from the US, and other parts of Australia as well. There are different pathways that people have used to become a PhD student in our research program. Some of them are undergraduates of our exercise and sports science degree here at the University of Sydney, and they've actually ended up in an undergraduate course that I've been teaching. And from that, they have enrolled in an honours project, which is a single-year research-intensive component of an undergraduate degree that gives you undergraduate honours in exercise and sports science. And then these people have done so well that they've then stayed on, acquired a research training program scholarship, which supports them to complete a 3-year PhD in my laboratory. So we have 3 PhD students currently in the lab who took that pathway. Other people have found out about us on the internet or through part of the website called Supervisor Connect, and they've reached out to me about specific projects that have been posted online that we're looking to complete in our research program. And then through different funding pathways, we've found a way in which they can come here and complete their PhD studies. There's no doubt our climate is changing, the Earth is heating up, and there's lots of urgent research projects that need to be completed. We're always looking for driven, intelligent, and ambitious PhD students to join our research program. In order to be a success, what we've found is that the best PhD students are collaborative, they're passionate about the projects they're doing, and they really want to make a difference. My name is Ollie Jay. I'm Professor of Heat and Health at the University of Sydney. Thank you for taking the time to watch my Study Australia Masterclass.